Okay, so I'm just going to give a brief update from Community First, from the CVS. And as I say, if anyone wants to ask questions, if you want to pop them in the chat, and then I can come back to you or direct you to someone who can help you. First of all, Community First has a development team, and we're very happy to support groups and help them recover and restart their services. We're also doing some research via some comp funding to understand what the state of the sector is at the moment and identify and put in place the support that's most needed. So it's worth, for groups that support health and well-being, thinking about new services or new ways of delivering the current services. Certainly going forward post the pandemic. So they can come to our development team and get support and help via them. So we can also look at, as I say, helping them restart safely and in accordance with any guidelines or restrictions. Volunteers, I know that there's always a need for volunteers. So we have Volunteer First, our volunteer service, and they can help groups to access and recruit volunteers, as well as helping to retain them. I think volunteers are always a fantastic strength, and really help to rebuild community resilience and reduce the demand on the statutory services. So that's two things that we can do and we continually do. There's also a couple of things, and these will come out in the minutes, but there's the Get Going Again grant, which is a community grant, which is a way of helping groups that offer health and wellbeing support to enable them to expand or develop new services. And it, might be worth looking at some collaborative or joint working within the Alton area. The local Resilience Forum is now very much focused on test, trace and isolate in response to the government guidelines. And there is now a test, trace and isolate board, which sits underneath the local Resilience Forum in Hampshire. This group is designed to provide support for vulnerable or clinically extremely vulnerable people who may need to self-isolate and are very likely to receive any additional welfare support. There are still some transport grants available, which can help people access health and vaccine appointments. And this funding will be available through the autumn. And we can give you the link for this on our website. That will come out in the minutes as well. There's also, and I think Jess may, or one of our health partners may want to update further on it, Hampshire and Isle of Wight Integrated Care System. This is a partnership of NHS, local government organisations, and it's been created to, I suppose, help join up the health and care services and work together to improve the health and well-being of local populations.
Exactly. Yeah, no, exactly. I don't even know the name of them, but it definitely East Hampshire Council.
I'm not sure if that one was someone talking to. I'm sorry, I couldn't hear who that was, and I'm not sure if it was.
I think I've muted people now, so you shouldn't get any back noise now.
Okay, oh, that's okay. So that's an update as far as the CVS is concerned. I think then we're going to move on to Jess, who's going to give a CCG update.
Thank you. So yeah, the merger of the Hampshire and Isle of Wight system is part of my update. So that's the first bit of news. So basically you would have known us as a number of different CCGs, North Hampshire CCG, West Hampshire CCG, etc. We've now all come together and are called the Hampshire and Isle of Wight Clinical Commissioning Group. So that's the big overarching structure. Within that, we've also got local systems. So you will have known me from North Hampshire CCG. North Hampshire CCG does no longer exist, but what does exist is what we call a North Mid system. So basically where I was covering North, I'll be covering also Mid Hampshire, which is Winchester, Andover area. So yeah, so and those local delivery systems are sort of connected to the hospital patches. So obviously it was be Hampshire Hospitals for us, and that's why we're sort of got that area to look after. So that's sort of news about our new structure. The COVID vaccine programme is going very well. Lots of vaccines been undertaken. We've still got some work to do to make sure some inequality groups get vaccinated. So we're working closely to get learning disabilities vaccinated, people with serious mental illness, and also we're looking to put on some Q&A sessions for the BAME population. So dates on that will come out soon, and that'll be via a webinar. And we'll be working with interpreters, and so they're accessible. The other, I suppose, of interest to this group is Alton generally quite good on the uptake. Some areas of we need to focus in on a bit more are Westbrook and Eastbrook. Those who live in Alton will be familiar with those areas. So any ideas about how we can increase confidence for people to come forward would be appreciated. I see Pam, you're nodding your head. What do we know about those areas?
Well, perhaps you should ask Paula Langley. She's the district councillor for Eastbrook. She might be able to give you a bit more info. I know we have regular reports from the primary care network, the A31, and all the surgeries that serve them put out notification, and the numbers have been truly wonderful. But Eastbrook and Westbrook are renowned for, well, they're not the most wealthy areas of the town, and they often fall behind in lots of ways. So I don't know whether Paula would like to comment on that one.
Great. I see she just put something in the chat box. Paula?
Yeah, so Eastbrook is actually classed as the most deprived ward in East Hampshire, and top 10, 20, 30% nationally for different areas of deprivation. So when you look at things like food bank use, that's really gone up over the last year and a half. Set up mutual aid, working with volunteers. We came across people with complex needs, so multiple needs within my ward. Whilst we were just delivering food, you get to know people and you get to see what they're ordering as well, which sometimes highlights multiple needs. But I think there's also a lot of working people and a lot of people working in lower paid jobs that have been hit hard by COVID in the ward. So it's a complex ward, and it has a real mixture of people in it. And I think, so because of high rents in this area, I get the feeling that there are quite a lot of people in work poverty. So families working multiple jobs with children and not enough money, particularly when 80% kind of hit. And also, people being made redundant and then getting lower paid jobs to try and at least fill the gap, but then that meaning they can't access any benefits because they're still too much, which isn't enough.
Yeah, I mean that presumably the Wilson practice supports most of Eastbrook, but also there are three schools within the area. There's the infant school, Alton Infants. There's Anstey Junior, and there's Wootty Junior and Wootty Infants. It almost calls for some kind of communication going out in the book bags, with the children taking the information through that way, and for the doctors to be in touch. I mean, there's a very strong PPG at Wilson practice. Being chaired by Derek Gurney, and I just feel there must be ways of reaching these people and impressing upon them. Lisa, do you have any links with them through King's Arms?
Our schools connector is Jen Hammersley and also Mandy May. We wouldn't with the infant, but we do support some young carers from age 8. Otherwise, we start at the secondary level. The book bag, the new version of that is electronic communications, which then really does go to the parents quite well. It's sent. Some of the schools do weekly electronic newsletters.
Brilliant. I shall look into that, holidays with Wilson. The other thing we've noticed is now that we're doing the sort of the teenagers, the 18-year-olds and to 25s, is it is slowing down, and we can make some assumptions around that maybe for that sort of age group, it's not, health might not be their priority, busy doing other more exciting.
I'm attending the PCN board meeting. I think it's next week. I'll try and bring it up.
Absolutely. The other thing I was going to raise, and Paula might know this, is there any sort of Facebooks or local magazines for those two areas?
Yeah, so I run my own Action for Eastbrook Facebook page, and I do share anything that I get from all of these groups, and it's often why I sit on these groups. But there are also people within the wards that aren't on social media, and that's kind of one of the biggest issues, I think, keeping in touch with our, particularly more elderly members of the community, although not predominantly, but a lot of elderly people are on social media. But I tend to find those most isolated aren't on social media. So if you're trying to text them or put it on Facebook or, send out digital things, there are a lot of people that you miss. But I don't know in particular age groups, that will obviously be different, won't it? But yeah, I'm happy to share anything on my actual Facebook page for sure.
That's really useful, thank you. So that's about COVID vaccine. In terms of other updates, just sort of, the restrictions are easing. People will still be anxious, but sort of a call for, getting back to, thinking about your health, getting active, getting isolated people back into community activities and such. And I know there is, I'm sure Community First will know this, but there is various pots of money coming from Hampshire County Council to get people back into community activities. So hopefully that will benefit Alton. So yeah, just hopefully once those restrictions ease and confidence is better, we'll see more people, accessing the community and getting active. So that's all from me, unless there's any questions.
Thanks very much, Jess. We're now going to Kirsty, who's going to talk about the East Hampshire Welfare Strategy.
Thanks for that. Afternoon, everyone. I'm Kirsty Cope, the Sports Development and Health and Wellbeing Officer for East Hampshire District Council. Just before I go on to talk about the Welfare and Wellbeing Strategy, just leading on from what Jess said earlier, there is some CEV funding coming from Hampshire County Council, which is looking at clinically and extremely vulnerable. Just to let you know that the District Council are putting in a bid for that funding, and we are working with Community First. So I'm not sure you've been updated about it yet, Jackie. But we're looking at doing a joint bid with ourselves and Havant Borough Council to expand their really popular Get Up and Go project that they run in Havant already. And that will be employing someone in East Hants and someone in Havant for the next 2 or 3 years to concentrate on working with clinically extremely vulnerable people and their families and getting them back into physical activity. So it's a kind of watch this space. Obviously, there's lots of people going for this funding, but that will obviously benefit the whole of East Hampshire, including Alton. So I'll keep you updated on that. Okay, so as you all probably know, the District Council has a welfare and wellbeing strategy that was adopted in August 2020. So we've just coming up to completing year 1. Obviously, a lot of the actions had to go on hold, or actions had to be kind of delivered in a different way. The strategy is available on our website along with the action plan. and I can send a link for that if partners are interested. To kind of accompany the strategy, we have got a pot of funding of up to £700,000. How we're going to use that funding is to commission projects that kind of meet the priorities and the needs identified in the action plan. We're just currently finalising the year 2 action plan at the moment, and we have engaged with all key stakeholders and organisations across the district to look at their priorities, and especially looking at COVID recovery as well. Becky Davey, my colleague, was employed and has been in post a couple of months now as the new Welfare and Wellbeing Commissioning Officer. What Becky's role will be to work specifically with key partners on commissioning projects. So what we're not going to advertise that pot of funding. It's not going to be like a grant. I think through working with our partners, if we identify a need in an area, then Becky will work with that partner to develop and commission a project to meet that need. We're currently scoring over 50 applications at the moment that have come into our Supporting Communities Fund. All those grant applications have a priority of mental health, social isolation and COVID recovery. And obviously I can't discuss grants at the moment, but there are some really exciting projects within that that are going to tackle directly COVID recovery and getting people back into physical activity, looking at people with mental health and long-term health conditions. So there is, all I can say is there's a lot of exciting work going on across the district. But of course, we'd be interested if partners have any views in your own areas that you would like to discuss, please contact Becky and myself. I think that's it. I don't know if there's any questions, or I haven't got the chat box up.
I can't see any. There was one earlier, possibly for Jess, asking, could we have an organisational structure for the CCG, possibly showing boundaries?
Yeah, I shall look to get you that, and it can be circulated with the minutes.
I just wanted to mention as well, through a former round of Supporting Communities Fund, I think it was last year, we supported a project to employ a mental health worker that works directly with adults as part of the A31 PCN. And I've suggested to Jackie that we invite her along to the next meeting to kind of talk about her role and how partners can link into referring people to her as well. Her name is Natalie Smith. So that they are the kinds of projects that we've been looking at to commission all through our Supporting Communities Fund.
Okay, someone's asked for your details, yours and Becky's, and those can go out with the minutes, if that's okay.
Yeah.
Or if you can type them, if you want to type them into the chat box, then they're available there. That would be great. Okay, well, I know, thanks very much. At the last meeting, there was a talk about funding and you know, how people can improve their success rate. So we've got Zarina has come along and is going to talk about practical steps to improving your success at funding. So if I can hand over to you, Zarina.
Thank you, Jackie. And can you please enable sharing facility so that I can share what I prepared for you?
Can I ask you to enable sharing facilities, please?
You should already have access to share.
No, it says you can't share screen while other participant is sharing. So, yeah.
Oh, that's okay. There we go.
There you go.
Okay, excellent. Thank you. Okay, just bear with me for a sec. And I hope you can see a slide now, and we can start a slideshow in a sec.
Can indeed. Thank you.
Yeah, excellent. So I just discovered that there is at least one person who knows me from previous work. But for those who don't know, I'm Zarina O'Donnell. I have over 30 years of experience of working in public sector, voluntary sector, and private sector in different countries. You can hear from my accent that I'm not English, I'm Ukrainian. And if for whatever reason my accent is not familiar to you, you're not sure what I'm saying, please shout and I will rephrase or repeat to make sure that you understand. I have a very short presentation and I emailed a copy of those slides to Jackie, so you don't have to scribble frantically everything unless you really, really want it, because after today you will get a copy of all those slides. Well, why I'm here to talk about fundraising or grant funding, because out of my 40 plus years, at least 25 years, I actively submitted applications for different funding streams, and this includes not only grant funding, but also tendering for services delivery. And I'm quite sure that what I will share with you today will be useful for you for both submitting funding applications or your tenders in order to secure funding for wonderful services that you can deliver in the community. But when I started over 25 years ago, I felt very much like Edward the Bear, which was sort of aware about just one way to coming downstairs, and somehow it didn't feel right. It was bump after bump on my head, and I submitted a huge number of applications, and success rate was not great. And I felt then that something needs to be done. I need to understand how to do things correctly. So I learned a lot, and actually since very early in my career, I had an opportunity to experience grant application process from the opposite side. I was invited to be a member of evaluation panel on number of international and national grant giving organizations. So I have seen two sides of the game, and will be able to share with you the key learnings which I acquired, which make me more successful in obtaining funding for my project than probably average person who you will encounter in voluntary or other sectors. And just recently, as an example, I secured 175,000 funding for a project to build community resilience on the Isle of Wight. So all that I will tell you, I will share with you, I used all those tips and all this knowledge to achieve success in funding applications. So why do funding applications fail? Well, first of all, the major thing is that people don't follow the guidelines. Guidelines are issued for every funding stream, whether it is standard specification, or it is grant program. There are very strict guidelines which look at eligibility of your organization, eligibility of your project, where you can check how exactly organization who has money is going to evaluate your submission, and a lot of other details. One of the reasons why those guidelines are set up is to ensure the fairness of the process and to make sure that people equally, those who are experienced and those who are new, if they follow step-by-step process, they increase the chances of their application being considered for funding. So please, if you want to get just one thing out of this conversation, make sure that you read very well and also follow all the guidance which are accompanying this funding opportunity. And the other thing which sort of linked to this is very often, when people have a really good project, they thought about it a lot, they prepared sort of all information suitable for application process. And then what they do, they cut and paste this information without tailoring to submit to different funding bodies. This could be a major problem because different funding bodies, they have different guidance, different priorities, and a lot of other factors which can play against the applicant who just cut and paste. Always, always tailor your application if you submit idea of your project for funding to different funding bodies. Next reason why funding applications fail is proposal is too vague. People didn't think about detail. People really don't understand very much how what they do will achieve the outcome they state they are going to achieve. There is a discrepancy between what they're going to do and sort of cumulative impact which they're trying to achieve. They're not quite sure about what specific activities they're going to do. They're not necessarily very specific about their target groups. And as a result, application fails because there is just not enough specific details, particularly when this application is compared to much stronger applications. The third reason why funding applications can fail is because the focus of the proposal may be too narrow. Maybe the target group will be too small, or maybe the type of activities that is offered there is not any significant impact or make really lasting significant difference. So it is very important to context and show your understanding of the context and also how different factors outside your target group or specific area of operation, geographical or activity, how they will impact on your project and how they are taken into account. On the flip side of this fail is the problem that proposal can be too broad. The intentions or goals which are stated within grant application can be really big. Point of total elimination of child labor or poverty or hunger. Well, it will be difficult to do it at a local level when you are talking about total elimination or elimination of, unless you specify in which area what you are trying to achieve is going to happen and how. So all goals that you state in your grant applications, they should be achievable, they should be reachable, possible to achieve, and they should be very measurable. It's if you can't measure it, it's not a proper goal, really, and there is no chance that anybody will give you money for goal like this. Another problem that people may experience is the fact that there may be not enough history in this organization. It may be a startup, or maybe due to nature of their services, although they existed for some time, they never applied for grants before. So basically, there is little evidence to say that this organization is credible, recognized, others trusted enough to provide funding for this organization, and so forth. And what is often happens in situations like this, the best way could be to find out, is there somebody in your area, geographical area, who is experienced, trusted organization with whom you can achieve some sort of partnership agreement, which can become a partner in the project delivery? Because this will add extra reassurance to people who in your funding application, that if you don't have experience or if you don't have skills yet, you will learn those experiences and skills through your partnership with another organization. And for example, the project I mentioned on the Isle of Wight, the key grant holder is, or responsible grant holder is, Community Action Isle of Wight, but two other partner organizations are working equally reputable, equally strong organizations such as Ride Aspire and West Wight Sports and Community Centre. Some of you may have heard about those. And Lottery Fund, who gave us funding, they were really very glad to see that this is not just a project of one organization, it is a project which is being implemented in partnership. So think about it. It can strengthen your application. The next issue which people experience very often, and the reason why applications fail, is because applicants are not able to present very clear theory of change. And I'm just very curious, how many of you have seen this requirement in different funding programs to present your theory of change? Yes, and well, it's wonderful, Jackie. I could not see everyone else on screen. Was it easy for you to address this sort of particular section of the application form? You are on mute.
Sorry, I was being good and muting. I think it is something that when you are looking at what your project is and what you're applying for me, it's about seeing that the process from the start of your project to the end and following that journey through. So, you know, it's not just delivering one service, it's about affecting change, or it's about enabling people to make changes in their life, depending on what it's for. But yes, in that way, it's about having a clear path, so you can actually see changes along the journey.
Absolutely. Thank you, Jackie. And it was a very good explanation of what the theory of change in projects is, because there are other explanations in different contexts. And this is a question or section of application form where a lot of applicants stumble. They don't necessarily understand what it is, or even if they have some explanation, because they are unclear about cause-effect relationship between their activities and the goals they're trying to achieve. They're unable to clearly present this theory of change, because it also includes your KPIs, milestones, a lot of other things to paint the picture, which are present in evaluation plan as well. And very often people are using wrong indicators. They're trying to measure wrong things. Sometimes by measuring those things, they can create an industry for themselves, trying to gather this data. And it could be quite complex, especially for new, relatively young organizations who are not experienced in this sort of work. And actually, with Community First, we are looking now at offering some of the training which will look at theory of change, how to plan your outcomes, and what will be used then in evaluation, project management tools and techniques, and project management skills. So keep an eye on what is being on offer, and please, if you feel that you can benefit from this training, do attend it. You need to remember that giving you money, grantors, they want to be absolutely assured and clear that you know what they're doing, and that what you are doing is going to deliver the outcome thereafter. And so having good knowledge and being able to express and outline clearly your theory of change for your proposal and your evaluation plan are really essential qualities of your application. And another sort of issue where people often fail is either asking too much money for what they're trying to achieve or too little money. And there is no clear justification for the amount of money they're asking. There is no clear cost estimate being presented. One of the things is, and especially it is typical for projects where people apply for multiple funding streams, they apply for different streams and they don't necessarily put in their applications that they may have already secured some support for this grant. And that is why they're asking from particular grant-given agency, not a huge amount of money, but just to cover the shortfall. Very often people have arrangements where in-kind contribution can provide significant support for the for the project and may reduce the necessity in large bids. But again, if it is not clear in your project application, then grant funding agency will look at it and think, well, people don't really know that they can't deliver this project for the money they're asking for. It's high risk, and so no money will be issued. So please remember that you need to use appropriate budget and appropriate request for funding to the size, nature, and contents of your project, and declare all in-kind or in-money contributions. So those were the most significant fails or reasons for fails of funding applications. And now just a little summary for you of top tips. First of all, check whether your organization and project are eligible. The number of times when being on the receiving end of applications, I found that people don't check it and put a lot of work into submitting an application and they're not eligible. If they checked it from the beginning, they would not submit this application. Secondly, follow guidance and give the grantors what they're asked for. If guidance refer to certain policies or certain information to be provided, make sure that you provide all of this information, because without this information, without those attachments, potentially your application will be considered incomplete, and so it will not be taken for full consideration. You need to show that there is a need in your project or service. And it should not be just your opinion. You should provide an evidence that there is a need in the community, and you also ideally need to show that you have consulted with your beneficiaries, with your target group, or used some other information which shows that there is a need. You need to be very, very clear to explain what you are going to do. And this theory of change, it's a special tool which shows those interdependencies between what you are doing and what results you are achieving. That you fully understand the cause and impact, cause and effect relationship between your project and goals and outcomes you're trying to achieve. And of course, be very, very clear about what difference you are going to make to your beneficiaries and how you are going to manage, to measure this difference. And you can use here qualitative and quantitative measures, and also case studies, which are part of the qualitative measures. And there is a particular sort of skill to write in really impactful case studies. By the way, next week on Tuesday, I will be delivering webinar about storytelling. And if you are using storytelling approach, and this is very specific, very particular approach to writing your case studies will provide really powerful evidence of the change you achieved before or you are going to achieve in the future. Next lot of top tips. As I said earlier, ask for the right amount of money. Be very careful to calculate everything and work on the full cost recovery basis, because you need to show that your project to survive, even if something is going on in the community through the life cycle of the project. And of course, you need to go to your funders, potential funders. Why should they fund you, you specifically, your organization? What is special about you? What skills, what experience you have? What quality measures, quality controls, governance arrangements you have in place, which make your organization credible, trustworthy, and able to deliver what you promise to deliver. Make sure that your organization stands up to some of the funders also, maybe not necessarily all, they will employ external validators or examiners to do due diligence on key applicants who are sort of considered for the funding to be awarded. And due diligence will include looking at your online presence, looking at your social media. I'm not talking about necessarily individuals, although if you are playing key role in an organization, then probably you need to be mindful of this, because potentially it could be checked. But also to look at organization itself, what are feedback, what are comments on social media about this organization. It all creates sort of your public image as an organization, and can help or hinder your chances to receive grant funding. And of course, check your application for quality. Check for quality means not only to read it and make sure that there are no obvious mistakes and typos. Make sure that all figures in the budget sections, etc., they add up. There are no unexplainable gaps or clear mistakes, which can show that people didn't pay much attention to application. Make sure that you explain as simple as possible, because one of the problems that we have when we write application forms, we know exactly what we want to achieve. We have a lot in our mind, it's everything clear in our heads, but whether other people who will read it will understand in the same clear entirely. And so it could be useful if you have somebody who is not involved in this project application, can actually read it and just say, you know, I don't understand some of the bits, because if they don't understand, there is a chance somebody else will not understand it either. And I call it Auntie Edna test. If Auntie Edna can understand, then everyone else will understand as well. And generally speaking, application forms for funding, they're not huge. They're not huge. So you need to be very cautious with your language and size. And of course, remember to keep the copy of your application, especially when in order to apply, you have to fill online form. Very often people submit and then they have no access to this information. So all those things, top tips from my experience as a person who applied for funding and person who considered applications for funding, I believe that they will help you to improve the success rate of your applications. And now, if you have any questions, please ask.
Someone says they're looking forward to your storytelling webinar.
Excellent. Thank you. Me too. I love this sort of webinars.
That was brilliant. Thank you so much. And as Zarina said, that the slides will be going out with the minutes, so you do have access to those.
Yeah.
And her contact details are there if you need to ask anything further.
Yeah. Thank you for the opportunity.
Thank you very much indeed. And what we were going to do now is just have a chat to everyone about the future of the forum, which way, you know, how we want to move this forward. So I'm going to hand over to Jess.
Thank you. So I think we've been going a couple of years. We've had some really good meetings. I was only chatting to Ben Gazaros this morning. He couldn't make the meeting today, but he wanted to go back and look at some of the outputs from the workshops so that we didn't miss any And I think Community First, you'll have a log of some of the minutes and stuff, so I can put Ben in touch with you to sort of collate that information. We're just thinking in terms of such good stuff goes on that, you know, to have a bit more recognition and visibility, I suppose. And I was thinking, and this is where Kirsty may be able to help, is I believe that East Hants District about setting up some sort of health and well-being sort of strategy group, and I just wondered if that's something we could report to, and in terms of someone from this group feeding into that group and vice versa, bringing stuff out of that group into our local group. But Kirsty, have you got any do you know that what the plans are for health and well-being group?
Yeah, in the year 2 action has been identified that we want to set up a health and wellbeing partnership for the district. I think we should keep this group separately because you know, it's an established group, it runs really effectively, but absolutely I think it would be beneficial for a member to either sit on and represent your partnership as part of the wider district partnership, or attend both, and I can, if we get a report, I can feed it back. So I'm happy with kind of either way. It hasn't, I haven't got any dates. I think we're looking for kind of towards the end of the year to start the first meeting of the district wide, and it will be a strategic group. So looking at kind of key organisations and partners that strategically are responsible for health and wellbeing across the district.
Yeah, I think that could work quite well, and also sort of vice versa, any messaging coming down from that strategic group in terms of, are we on the right track? Are we meeting, you know, your objectives in terms of, you know, we could look at funding and things. I think that could work quite well, as at the moment it's very standalone, this group, and although it's done lots of stuff, it's not got really governance. So I think that'd be really helpful for this group to be more visible, and we share all the wonderful things that have been done. And we can
I was going to ask that because I did ask Jackie if it had a terms of reference, this group. Has it not?
It was Ben asked me, and I went, of course not.
I think this group came out as a direct result of the Alton Health Review, which happened some, I don't know how many years ago now, and it was decided to keep the groups together, and it has worked particularly well. I am concerned at the moment in the going forward, the health and wellbeing in Alton Town Council has its own health and wellbeing document, which I think was circulated last time. But whether you're aware or not, at East Hampshire last night, they agreed in principle to allow a 1,200 housing estate at the end of Chawton Park Road, incorporating into their new local plan. And it suggests there will be some facilities on the site. There will be a new school, but it refers to them being able to use Alton's facilities. Now, we only have 2 doctor's surgeries. We have a very small community hospital, and that's another one I'd like to talk about in a minute. And we're talking about all these extra services being available, but excuse me, currently they're not going to be available.
No.
Unless we start looking at it now.
Absolutely. So we are aware that there is happening in and around, and we will be looking at an estate strategy. Do you know the name of the housing development, Pam?
Well, it's called Chawton Park Farm, and it was on the front page of the Herald, I think last week or the week before last. Chawton Park Farm development. It's not actually within the settlement boundary of Alton. I believe it's within Chawton, believe it or not.
And has it gone through planning permission? What stage?
Well, all they've done is they're looking at various sites for the new local plan, and they had a choice of 10 sites, and they had to relocate some of them from Borden because of environmental issues. And they looked at Chawton Park Farm as being a possible alternative. And unfortunately, it's met with a great deal of opposition, needless to say, from people in Alton, but it was actually, it went through the planning committee, the planning policy committee, I should say, last night at district, because I dipped into the meeting.
Okay,
So I haven't seen the minutes of the meeting, but just to flag up, 1,200 new homes at the end of
Okay.
Chawton Park Road, which is going to be an absolute, and Sarah's nodding, it's going to be an absolute nightmare, logistically as well as anything else.
okay,
So,
thank you for
So, so
Can we just-
myself and
So I was going to say, can we just focus back on, Jess was looking at what we want the future of the
yeah,
forum
that's
to
fine. And Pam, I think you also raised a good point about your town health and wellbeing strategy, and I think we do need to use this group to help you deliver that. So
yeah, I was looking.
Next time.
I was looking back at my involvement with the health service in Alton. My first baby was due to be born at the Alton when we used to have one, which was closed for rewiring back in 1979 and 78, never reopened. So we all had to go to base. Then when they removed the Trelaw Hospital, they were talking about building a new community hospital, and I was involved with NCT in those days, and we desperately wanted to have at least a lying-in facility at the new hospital, and we fought tooth and nail for that one and didn't get it. I believe when I was mayor in 2003, I had to sign the documentation to go to the Secretary of State to allow Chawton Park surgery to be built. Involved in various other, I was on the steering group for the neighbourhood plan, and we fought tooth and nail to make sure the community hospital was still there. It's included in the neighbourhood plan. But all the way along the line, we have that little hospital sitting there, underused. And I really do believe the trouble is it's run by Southern Health, not by the North Hampshire Trust. And this has always been difficult. And I think these health and wellbeing meetings could be attended by representatives of those two trusts occasionally to come and talk to us.
Action, Pam, and I'll speak to Ben to see.
I mean, I'd like to come in and agree with Pam completely, because there seems to be, this is the reason why I asked for a sort of a structure as it will now be constituted, so that we have some idea who on earth we talk to. If there's something that's going on in the health sector area, who do we talk to? Who in Southern Health I'd talk to? Solent Health have been delivering services in the area. We obviously have the Hospital Trust, we have the primary care networks. It's how does it all fit together for the third sector organisations who are represented here, delivering services, trying to tailor and side the NHS establishment. It's really difficult for us to know who to go to talk about what we want to do if we have a new idea, such as running long COVID. Is it the CCG? Is it the current provider? Is it the GPs? It's just quite difficult for us.
The other
We've
thing
got time for, I was going to say a couple more questions.
Can I just flag up that came out today from Health Watch Hampshire, the result of their health priorities survey for 2021. I can send it to you for you to circulate, because it makes interesting reading.
We've only got a few more minutes left. So Pat LaRue.
Can I make a comment, please?
Yes, I was going to go to Pat first and then come to you afterwards. But
all right, fine.
Yeah.
Charles, I may be making a comment that Charles and I had a meeting with some people from the Hampshire and Isle of Wight CCG yesterday, and one of the focuses of our comments there and discussions there was about the underused community hospital, and that there was no sort of PPG for the community hospital. And I actually offered mine and Charles services to start one. I don't know.
There is
I think
of the hospital.
Yeah, but they fundraise and things. They don't actually bring.
I've not heard of a hospital PPG either.
Well, we don't mean we can't start one. I think it's one of the fundamental issues of Alton and the sometimes poor service for Alton.
Can we in that case make sure we all sing from the same hymn sheet?
Yeah,
absolutely. It's not six.
Yeah, well, this is what we would like to take forward.
Charles.
Just to reinforce what Pat's, We didn't get the impression from our discussion yesterday that there was massive will to drive forward an improvement plan for Alton Hospital. And I think Pam is correct in this. We have to sing from the same hymn sheet, and we have to ensure that action is taken to improve delivery. Anyone you talk to will tell you that the facility is underused, but nobody seems to have. And I think it's up to us to suggest one, and then to drive that through. And we will need G on side, but we will need to actually have active discussions with Southern Healthcare Trust as well. I'd be glad to take part in that. Thank you.
Thank you. Jess, I'll go over to you to close now.
Yeah, and I've got, as usual, back-to-back meetings, so I've got but thank you all for a really well attended meeting as always, and your contributions. I'm hoping that maybe the next one could be face to face, so let's have a discussion about that.
We're looking at November, and yes, hopefully by then we'll be able to be face to face.
It'll be great to see you all face to face again.
Okay, well, thanks very much, everybody, and we will get there are some other things in the chat. You can actually save the chat, so if you click on the file, you can actually save it to your laptop or phone or whatever you're using, and we will get the notes out to you in due course. Thanks very much indeed.